Hey, it's Naturopathic Medicine Week, and I'm Dr. Brianna Botsford, the founder of Flow Functional Healthcare in Edmonton and a naturopathic doctor myself. This week is a time to celebrate naturopathic doctors, whole person care, and taking charge of your health from the inside out. This week, we're sitting down with our patients and colleagues who want to share their unique experience working with naturopathic doctors. Whether you're curious about natural medicine or ready to feel inspired to take action for your health, you're in the right place.
Hi, everyone. I'm Dr. Jules Passy, and I'm a naturopathic doctor at Flow Functional Healthcare. And I am here interviewing my husband for Naturopathic Medicine Week. What is your name, sir?
My name's Scott.
Scott. And what do you do for work?
I'm a pediatrician.
You're a pediatrician. So we are going to talk about how we bridge the gap in healthcare and get Scott's perspective on what I do as a naturopathic doctor. So you've known me for how long? A long time. A decade. Dates don't
Decade and a
matter.
half, yeah.
Yeah. Newsflash, this is actually a podcast about two people laughing, right? But we're actually married. You've known me for a decade. You've known me since I started practicing. Give me an idea. How do you think I've changed as a naturopathic doctor in the way I practice from when you first met me until now? And I know there's layers to that because I've changed practices, I've changed provinces, so my scope of practice changed a little bit. But just, give me an idea as to how you think that I've changed or evolved in the way that I practice.
Yeah, like you said, you've changed provinces and practices, and that comes with different scope, which I think has brought you like good experience and exposure. You've seen different patient populations in different places, like in a bigger city like Toronto, in a more small rural place like Vancouver Island with different resources and patient populations. But then there was more prescribing there. So that came with different therapies and options. And then here, where it's kind of a mixed practice of people from Edmonton and people more rurally again. And yeah, not prescribing, but different patient populations demand different things, different disease patterns. You've shifted your focus a bit, still staying general, but picking up a couple niches along the way.
Sounds like you've read my website.
I haven't.
You just made it.
I helped make it, but I didn't read it.
Oh, okay. Well, now we know. So there's been a scope change. I want to know, so since you've known me, how do you think that you've applied the principles or things that we teach in naturopathic medicine to your own life? Like, what do you think you've changed from, when you were in med school and you were living alone to us being together? How have maybe some of your habits changed, and what are those habits?
In medicine? Yeah.
Not in medicine, in your real life.
Oh, in my real life?
Yeah.
I mean, things have just changed over time, I think, for both of us. When we first got to know each other and were together, there was a big shift for just being aware, just a lot more awareness of like what we're eating, what we're doing, supplements. Like I had never taken any vitamins or supplements before, and you always have a cabinet full and not really knowing anything.
Not that I take them all.
And just there's a big learning curve about like learning what different things do and why and when and stuff like that. And then, just how, I mean, you always learn about diet and lifestyle, but seeing you live that and then living with you, you kind of adjust to that as well and make a lot of the same changes. And then, I mean, things have changed. Getting married, moving, and then especially having kids, I think that's had a big impact on the way we live, what we eat, supplements, and it all just goes to show like how diet and supplementing what your diet and lifestyle is like with things from naturopathic medicine can support you throughout your life, whether you're single, going through school, or working, or trying to get pregnant again, maternity stuff, or even and then having kids, different energy levels, different health issues that come up as you get older. So
Can you be a bit more specific, even with like maybe one component of that? Like think of dietary, how specifically did your dietary changes? And I can give you
How
an
specific
example.
do you want me to be?
No, I think that one thing is you became way more aware of your protein intake,
Oh, okay.
especially in or around exercise. I think that you're always aware of foods that you should be putting in your body, like veggies and fruits and things like that. But I think that, especially over the last few years, with your interest in increasing your exercise levels, you have been more aware of how to better fuel yourself.
Yeah, protein intake and then like healthy protein intake, how to get that from your meals at different times of the day and like before and after workouts, and then in recovery and through your diet, and then also through like different supplements and things like that help, yeah, with exercise.
You're very vague with your supplement conversation.
Well, I thought you were gonna go for tummy trouble area and
no. That's private stuff. So
I was gonna talk about it.
You're gonna talk about it. We can do that later. So I guess along that line, we have kids, and for yourself, what supplements, like knowing that you do pediatric medicine and we have kids, so what supplements do you maybe now recommend or think are important for our own kids that maybe you wouldn't have been?
Melatonin, lots of melatonin. No, the way we use melatonin is different, and I think that's been good to learn about. Yeah, like more so like supporting immune function. I mean, kids don't always eat the greatest, and depending on their age and stuff. And, they go to daycare, they get a bunch of viral issues and stuff a lot, and then they bring that home, and you have to try and stay healthy or at least fight through different things as well. And so both like diet and then like immune supports with different supplements. I don't know how to be more specific. I don't know the names of them, but
no, but you know the types, like
echinacea and like some other like.
Yeah, but those are the immune ones. I'm thinking of like on a day-to-day. So I think you're well aware in kids, the beige food era, and potentially issues around their iron levels.
Yeah, and so like supporting that with like
vitamins and things like that. So I think that you're way more open to adding things like that in to complement a kid's diet, no?
Yeah, for sure. I think for a couple of reasons. One is seeing your kid on the beige diet for a while, you get worried.
Yeah.
And you start to look for other things, especially, the general pediatric advice is to offer them, the well-rounded meal, balanced diet, all the different food groups and stuff. And when you see them just kind of pick over things and not eat things, and they're kind of missing some things from their diet, then supplementing with iron, helping out with some vitamin D, some B vitamins, vitamin C, and seeing how things like that can kind of work together to help out their nutrition and doing it at safe doses. And yeah, you definitely help out with that, with getting the confidence and guiding some of that process as well. So
then why does our older daughter think you're more of a real doctor?
This is gotcha. I don't know. I think maybe just because I wear scrubs.
Did you?
Sometimes.
Yeah, you do very nice scrubs.
You gotta get you some
stylish style. Maybe if I wear scrubs on a regular basis, that she'll change her tune a little bit. So yeah, on that note, how would you explain to even one of your patients whether they might benefit from seeing a naturopathic doctor? What would a situation like that be? Like, think of in your population base, someone that could have added value from the type of medicine we do. Can you give like a brief explanation what that interaction might look like?
Yeah, I think when we start talking about different diseases that and the components of like diet and lifestyle, instead of just saying diet and lifestyle and well-balanced diet and going through the food groups and stuff, talking about more specific ways to address diet, whether that's from like a undernutrition point of view or like excess and how to approach that in a more balanced way. Then also just the regular, like we've been talking about, like viral illnesses, how to get through viral season with kids and stuff like that. Sleep and behavior, some of those issues. There's medical management and behavioral and environmental management, but then there's other things that they can do in your realm that help out.
A complement,
Yeah.
I'd say. So then that brings me to my next question. So I know it's hard to define exactly all that is naturopathic medicine, but how do you think, like, what I do complements your realm of medicine? Like,
Yeah,
how
I think
do we bridge that gap?
Yeah, I think different patient populations tend to be attracted to one or the other, and there's a lot of misconceptions, both from the medical side and from the patient side, about what we do, what you do, and it seems quite adversarial, but it can complement each other a lot through all the things we were just talking about: nutrition, through disease, illness, whether that's like an acute thing or more of a chronic disease process where maybe there's other things to supplement with, and
What
then just the
about,
regular phases of life.
not to prompt you, but besides like those specifics of like nutrition and diet and supplements, why don't you, just maybe even compare the structure sometimes of our visits? Because I think we both really practice and focus on patient-centered care, where it's like we want to put the patient first. We want to make sure our patients are validated and heard. But thinking of just like, how many patients I may see in a day versus how many patients you're seeing in a day, like what are the structures of our visits? Because I also think that like your touch points for patients are different based on your population. But maybe do a brief overview of that.
Yeah, so we try to focus on like high frequency and dealing with a few issues at a time. I mean, certainly sometimes you're dealing with a dozen issues, but and dealing with more acute things. So anyways, the visits tend to be much shorter. Sometimes it's 5 or 10 minutes, sometimes it's still, an hour, but it can be quite varied and quite focused, where I think you try to take a little bit longer, you approach things, not more thoroughly, but like you try to go over a bigger breadth, I think, each time, and especially the initial time, and talk a lot more about in-depth different options, where for certain aspects we would maybe skim over some things, make some recommendations, maybe refer not, maybe start different treatments, and then kind of touch back on that in future visits, where I think you can sit down and talk about things in a lot more detail.
So I'm thinking of like a particular moment where you came home one day and you said you accidentally referred me your first patient. But the reason that came up is because it actually wasn't necessarily a good fit between like the person that you had seen had misconceptions about what we do as naturopathic doctors. So can you go over a bit of what those misconceptions commonly are, or even things that come up in your practice where you think people really don't know what naturopathic doctors do, or they're confusing it? What kind of practitioners do they confuse naturopathic doctors with?
I think there's a lot of confusion between naturopath and acupuncture only practitioners, or homeopathy only.
What else? You
There's
talk
some
a lot
difference
about
between like functional medicine doctors.
Yeah.
You're just trying to prompt me.
I'm trying to help you.
Yeah. And then like in terms of what patients think, sometimes they think it's all just kind of voodoo and there's homeopathy, and then it's explaining to them that, you do go into a lot more depth about different aspects that might be concerning them. We keep mentioning diet and lifestyle, but like really there's a lot more things like hormonal changes. When we're seeing a kid, we're also seeing parents, and there's like some prenatal and postnatal help in different phases of life for the parents and the whole family that sometimes deserves like a deeper dive, and to see, maybe there aren't good medications, or medications have significant side effects that aren't really worth it, and there's other ways to explore how to help them. There's the other side of things where people are quite hesitant around medications, understandably, and they think that going to a naturopath means lots of natural
alternatives that are equivalent.
That are, you know, a lot of things that you do are evidence-based, and there's a lot of knowledge behind it, and there's specific recommendations and treatment plans and things like that. And I think some people think that just, you know, going natural and you know,
I think
eat some
that
more spinach and kale and
vaccines are a big thing that come up in your population. So vaccine hesitancy, I think that a lot of people see that we or feel like we might have alternatives, which we don't. And I think that, yeah, there are specific types of belief that there is equivalent things, and a lot of times there aren't, even from like your side of things. When I know something that you really taught me that sticks with me is, especially in pediatrics, how kids are incredibly resilient until they're not. And sometimes it's a really quick or fast switch. And so it can be sometimes difficult to navigate, like, how severe is this? How quickly do I have to act? But that often even applies sometimes when it comes to like antibiotics and things like that, where parents are hesitant in trying to reduce the frequency of it, but there almost never is an alternative if antibiotics are a necessary thing to treat the infection at hand, right?
Yeah, and I think that's where things complement each other really well, where doing probiotics, the type of antibiotic, the dose, the age of the kid, the different kind of risk factors for any individual patient, and knowing how to help that specific patient. From the medical side, there's more of the acute treatment. From your side, it's helping to support their immune system or their GI system or hormones.
Preventative, maybe recurrent, something like that. But yeah, feeling like there is actually a lot of synergistic action or a lot of things we can do that complement the treatments that you're getting on a regular basis. So there actually isn't an either or. It's like often both, right? Both are present. So a question for you: do you correct people when they call me a naturopath?
I don't think I've had anybody say naturopath.
Are you sure?
I don't think so. I think if I caught it, I would correct them.
You would correct it quietly so people could.
No, mostly people start talking about, you know, those other things like homeopathy or functional medicine. I'm like, oh, that's actually not what a naturopath does. Or correct a lot of doctors, to be honest, about, oh, this patient was on this medication or had this testing done, and they said it was from the naturopath. And you do a bit of digging because you know that that's out of your scope, or you know, you didn't, and it's important to find out how things actually unfolded. There's instances where it is a different type of practitioner, and
totally, like, yeah, you've had people on supplements dose wrong, inappropriately prescribed, and then sometimes that digging is like they've either self-prescribed it or they're getting advice from
the internet,
unlicensed individuals that are just like kind of giving like generalized health advice. And I think that sometimes when we see people are on supplements, it's like this automatic, like, who told you to take that? But that's not often the case. And I think that, yeah, that just goes to show, like, yeah, people find their information and can find anything they want on the internet. And that definitely impacts both of our practices in terms of like what they're finding, and sometimes at the questions that they have with that.
I think at the end of the day, we both just want to help people in the best way that they need to be helped. And sometimes it goes this way and sometimes it's more that way. A lot of times there's areas for both, and it's trying to help people and other practitioners understand that.
Now, tell us about the gut stuff. Don't be shy. What were you going to say earlier before I cut you off? No, I wish I didn't cut you off when you were talking about your gut health. Because that's a major topic in our house, always.
Whatever.
Free-flowing one.
Usually free-flowing. Sometimes it's a bit of a constipated conversation. But yeah, for different phases of life and different people in our household, sometimes things flow easier and sometimes things don't. And you just want to be comfortable in your body. And there's ways to do things with, the way you eat and fiber and changing up your carbs.
That's
or
something you
dairy
have
intake
added in is you're big in your fiber.
And then sometimes there's other things, and maybe there's things that you've given me that you regret.
That was early in on practice, and yeah, you learn your lesson the hard way. But yeah, that hasn't become a common part of what I do.
I forget the name of it, but it tastes
Not
awful,
important. It's not
and
important.
It ended up
It was a
smelling even
prebiotic.
worse.
It was a prebiotic formulation that fed the wrong type of bacteria from an odor perspective. Yeah, I'm just wondering, is there anything else that you want to add that you think is important? That I know it's interesting because you know a lot about what I do, a lot from like what I share, how my days are structured, just like knowing me. But I know you've also never seen a naturopathic doctor or had an actual visit with a naturopathic doctor. So I'm just wondering, are there questions that you have, or is there anything else that you want to add from knowing me and like our differences and how we approach medicine?
I would just express that, we agree pretty much all the time. I don't think we've ever really gotten into an actual like medical disagreement.
Why does everyone think we don't get along?
We just end up, like I said, doing what's best for the patient, looking at the evidence, looking at how to figure this out. And there's a lot of gray zones and unknowns, and you find the best evidence and do what's best for the patient. And I think we both agree on that. And I think it's
it's not fighting like black and white, all or nothing, your way or my way. I think we've always been really good at understanding the other person's approach, based on their training and experience and the evidence and things. I think it's really cool because now we're seeing, even from like a medicine point of view, there's now like databases that do integrate both like natural health products and like the best or first line medications and pharmaceuticals. We're able to better detect interactions, how they work together, and that kind of thing. And I think that also helps us make like both good clinical decisions in terms of like how we're advising our patients, right?
Have you spent a lot of time and working really hard trying to communicate with MDs, sending them letters, communicating with your patients, explaining diagnoses and treatment plans and why you're doing what you're doing, or why you're just sending them back to a physician for an idea on a diagnosis or a differential and investigations and treatment. And, sometimes it seems like being a naturopath, you can be quite defensive about how people perceive you and what you're doing, especially on the medical side. How have you seen physicians change over time? Because I think sometimes there's a bit of maybe even arrogance.
I didn't know you were interviewing me.
If I have any questions.
Yeah, that's true. So I think number one, it's really interesting because like based on colleagues and friends, because we know lots of people in different specialties, I think they're very open meeting me first versus like meeting me through my patient first in a sense, where there is a lot more openness, and then we can have like really good productive conversations. And I know that they often feel like we're very much on the same page. I think that it's hard. The naturopathic medicine has evolved a lot and it's changed, right? And I think that with technology and our access to medicine, just more research that's come out, it's like, oh, okay, now we can show why naturopathic medicine, like through the evidence, is really valuable versus potentially decades ago, we didn't have that same access to information, right? I think naturopathic medicine was approached differently. As you said, there was many different components that were maybe focused on. And again, it's hard to differentiate, okay, a homeopath and a naturopathic doctor that practices some homeopathy. And it's like, actually, those are really different and different changes. I mean, different professions. Like an acupuncturist versus a naturopathic medicine that is trained in acupuncture, which is a lot of us, right? So it can be very confusing. I know some, or probably it's likely naturopathic doctors do identify as functional practitioners. A lot don't. And so then there's this other layer of confusion because technically any specialty can slap on functional medicine, and we kind of like say it's all natural, right? And it's all like getting to the root cause and figuring out how your body works, but like there isn't a lot of validated evidence behind it. So it becomes like very confusing. Forget what I was answering.
That's okay. No, that's good. Yeah, I think people tend to focus on the extremes. Like, you're not going to resuscitate somebody with naturopathic medicine, but that's not what you do. And you're not going to.
That's where medicine doesn't overlap, because you actually do quite literally life-saving therapies for your patients, because you do inpatient and outpatient care. I also you do a lot of very complex medical conditions, which is where you said you have a lot of touch points for those people, and you actually provide very good medical care. And then, but there is, of course, different populations that both you and I
think one of the big overlap areas is weight management. Medicine has gone quite extreme one way, and you say, hey, just take this once weekly injection and all your problems melt away, versus, people might see natural medicine and just say, oh, take this tincture or take a tapeworm and all your problems melt away too. But really the middle ground is using, medical therapies and your therapies and combining them. And that actually leads to the best results.
Providing a lot of support.
Yeah.
In between. Right. It's totally a combination. And I think that when people have all of the information, then they make the right decisions for themselves. But there's so much misinformation that gets really clouded. So it's good. People get both of us.
There we go. We started a podcast.
A couple laughing sometimes about my husband's gastrointestinal issues. Hey, thanks for listening.
Thank you so much for watching, and a huge thank you to our guest for sharing their story today. If this conversation sparked something in you, don't wait. We're here to help. You can schedule a complimentary 15-minute visit with one of our naturopathic doctors at Flow Functional Healthcare in Edmonton today, or give us a follow, like, or share this video to help us help more people live healthier, more energized lives.